we're going to start with the interview regarding your professionalism in healthcare. Your name, please,
My name is Lillian Gonzalez.
and your profession.
I'm a social worker at a dialysis clinic.
Certification.
Licensed master social worker in the state of Texas.
All right. How long have you worked at your current job?
I've been here going on 3 months, approaching 90 days.
So, being new to this setting, how would you say you have adjusted?
It's been a difficult adjustment. I come from a completely different background, and it's a lot of learning different stuff. But I think with the coworkers that I've had, the help along the way, it's really helped out in the adjustment stage.
Okay, and talking of coworkers, how do you feel you build your rapport with your coworkers?
In my current situation, my current setting, I would say that I'm very vocal with my coworkers. Anytime that I need something, anytime that there's questions, I don't hesitate to go and talk to them in anything that I need. And on the other side, they've been very welcoming with me. Anytime I need something, they're there to guide me and help me. And, we work very well together.
Okay, and being that you're new, I would want to go like to a past job. How, in seeing those colleagues, how did you maintain a professional relationship with them?
My past job was a little bit difficult with my coworkers, but I always remained professional, and I'm a firm believer that work is work, and you don't bring your personal life into work. Anytime communication needs to be there. If a coworker needs help, I'm there to help. I remain professional, whether those people have or not. That's a different story. But as far as me, work is work to me.
Okay, sounds good. Now turning these interview in regards to patients, how do you feel? I mean, in seeing them daily, you would build rapport with those patients.
I've noticed that since working here, I've already built a rapport with these patients. I make it a point to have them see my face, maybe not on a daily basis, but on a weekly basis. Go ask them how they're doing, always smiling, always asking what is it that I can help them with, offering my services, telling them several times my name. That way they'll remember me and they'll remember a face to the name.
Okay, I know I heard you say about your past job and your colleagues and possible, I guess, difficulties there. In thinking of that, how do you build rapport, or how do your professional barriers differ from your coworkers and your patients? I'm sure there's a difference.
Well, my patients, it's more of I'm there to help them. I'm there to assist them, as well as my coworkers. Because anytime someone needs help, I'm always willing to help with that. Um, how it would differ, um, I guess on the professional side, on the coworker side, they see my struggles. They see my flaws. They see that I'm stressed out, as opposed to the patients. They don't see that. All they see is a smiley face. They know that I'm here to help. Anything that they need, I'm available for them. And you know, patients shouldn't see the other side, the stressed out, the bad days and stuff like that.
Um, so as far as your relationships with your patients, how would you say you continue them in good standing, with them having that trust and confidence, and them being able to openly go to you as a professional?
Like I said, I think it's important for them to see me on a consistently, and always welcoming them, always asking them if there's anything that I can do for them, anything that they need. I do like to make it a point to go visit with them, see how they're doing, get to know them, see what struggles they have, how their family's doing. And I think it's really important to, when meeting with these patients, if they tell you some kind of information, like birth of a grandson or something, that you remember that, and it for the next time that you speak with them, and they appreciate it. They appreciate that you're remembering the facts about them, and they're not just a number. They're actually a person to you, and that's the values that I try to impose while here at work.
Okay, and is there a certain particular situation where a patient relationship was challenged that you can think of as far as?
I think there was probably an incident where my frustration was challenged a little bit, but through no fault of the patient, of course. The patient is mentally incapacitated, so I mean, it's not their fault. It's just something from within. You have to maintain your composure, breathe, and offer your assistance in any way possible. But yeah, that's probably been the only time.
So I guess not to hinder the relationship.
Yes, not to hinder the relationship that you're there, and then especially because other patients are watching you as you're dealing with this one patient, so you have to remember that. Keep your composure, and not to tarnish the relationship that you build with all the other patients as well.
Okay, and then I know in speaking of challenges and things like that with patients and the relationship, I'm sure as a professionalism, code of ethics is something that plays a part in your relationships. So I guess in general, what role do you think your code of ethics has helped you in situations like that are challenging?
Well, I think with my code of ethics as a social worker, it's it's always the patient first, patient self-determination, helping the patient any way possible, and not crossing that boundary or that barrier with the patient, because I have had patients who ask personal information and information that has nothing to do with the discussion, and you do have to watch it. You have to remain professional with the patient and inform them, what, unfortunately that's not something that needs to be discussed, and then just move on politely. It doesn't have to be in a confrontational way, but just move on from that.
Okay.